Hello, everyone, and welcome to today's podcast. With the festive season approaching, it can be tempting for our patients with diabetes to indulge in carbs and sweets. However, for those managing diabetes, and in some cases, other health concerns like chronic kidney disease, balancing these festivities and festive treats with their health needs is critical. Today, we are joined by Dr. Sanjay Kalra. He's a distinguished endocrinologist based at Bharti Hospital, Karnal. He currently serves as Treasurer, International Society of Endocrinology, and Vice President of South Asian Obesity Forum. An expert in diabetes management, he will guide us on practical ways to enjoy festivities without compromising health. Dr. Kalra, thank you for joining us.
Thank you for the opportunity and good day to everyone who's watching us.
Thank you so much. And to start with, sir, could you please elaborate on why carb and sugar intake becomes a critical discussion point during festive times, especially for diabetes management?
This is a very valid question, and the reason is that our entire metabolic health depends upon carbohydrates. It depends upon how much of carbs we consume, what kind of carbs we consume, and also how those carbohydrates are metabolized in the body. Especially in persons with diabetes who have limited carbohydrate metabolic or metabolizing capacity, it becomes more challenging. And this comes into stark focus during the festive season because, you just keep on eating a little bit more, a little bit more. Somebody will tempt you, just take half a samosa, take half a gulab jamun. Those half plus half become quite a bit. So there is an increased load of carbohydrate consumption. People with diabetes are not able to manage those carbs. And that's why glucose control and overall metabolic control goes for a toss. Not only that, it's not just that you're taking carbohydrates, other things also change. The kind of beverages that we drink, the timing of carb intake, the timing of beverage intake, the amount of time spent on exercise. So during a routine working day or a working week, you might exercise more. And during festive season, you might want to relax and spend time with friends and loved ones. So the exercise time also goes down.
Thank you, sir. Going on to our next question. Understanding that carbs and sugar can significantly impact blood sugar levels, what practical advice would you give to help patients manage their intake while enjoying festive treats?
So let's go through it one by one. If you want to manage your glucose during the festive season, first of all, ensure that your carbohydrate count is rational. The total amount should be rational. Second is look at the redistribution or the distribution. Make sure that the carbs are distributed properly throughout the day. That is related to the intake. But what do you do before the intake and after the intake? Before the intake, you might want to take practical measures to reduce the absorption of glucose or carbs. We can talk about that later. And secondly, after you've taken the carb, what can you do? Do not feel guilty. Go and burn those calories. So before the carb, kind of preempt carbohydrate absorption, take a drug or take a food which will reduce the rate of carb absorption. An example would be acarbose as a tablet. Another example would be high fibers or fluids, so lots of salads or water. As far as the carb count is concerned, try to reduce it as much as possible. Try to spread it throughout the day. And if you have indulged, then just go out for a walk or a run, exercise, burn out those calories.
Thank you, sir. That's very helpful. If you could just quickly list down a few things which they could take as measures, as in the top foods that they can avoid or have before or after. So, a list of top 5 things they should do.
So if you want to manage carb intake during the festive season and otherwise, number one, start with fluids and fiber. First fluids, first fiber. Drink a lot of water, drink fiber-rich fluids. You might wish to take a tablet of acarbose to reduce the absorption of glucose. As far as the meals are concerned, prefer complex carbohydrates to simple ones. Simple carbs would be simple sugars, honey, fruit juice. Complex carbs are those that you get in cereals and whole grains. After the meal, go out for a walk. Maybe not an intensive run, but a brisk walk should suffice.
Thank you so much, sir. So, going on, how do we plan our meal? How should patients actually structure their meals and avoid significant spikes in blood sugar?
The best way is to take small, frequent meals. And this is especially true in the festive season. Now, if you want to take small, frequent meals, the first thing then to do is to structure your life around that. So instead of having time for, let's say, three major meals, breakfast, lunch, dinner, or some people take just two meals, one in the morning and one at night, you try to squeeze in snacks throughout the day. Do it at your workplace, do it at your home. The snacks should be nutritious, they should be healthy. So you work around that as well. Some practical tips: change your cutlery, change your crockery, use small sized plates, small sized glasses. When you go to the grocer, you buy healthy food. If you are not going to buy unhealthy food, it's not going to reach you. If you're at work, you can keep roasted gram or maybe dry fruits, or you just leave a couple of cucumbers in the fridge at workplace. So each one eats one cucumber when they come back. Keep a carrot in the fridge at workplace. Do not keep radishes because otherwise everything will end up smelling and your colleagues will get angry with you. So carrots, cucumbers, these are things you can do during winter. Keep roasted gram in your drawer. It would be a good idea to keep many, many packets of 50 grams each. Otherwise, if you keep one big box of 1 kg, you will find that your friendly colleagues at work will eat it all up and you will have to bring another one the next day. So these are things that you can do. Surround yourself with healthy food and make sure that your crockery is optimally sized.
Thank you so much, sir. That definitely should change a lot of things for people. So coming on to the next thing, what are like beverages? They are another hidden source of sugar. So any tips on managing the festive drinks?
This is easy, and I have faced this problem at home. Many of my relatives have diabetes, and my mom, she's 82 now, and she always used to fret about what to give people who came. Uh, Earlier, we had, the aerated drinks, which have something like 44 calories per 100 gram. Then they were replaced with the Tetra Pak fruit juices, which are equally worse, if not. They have high fructose corn syrup. So now what we use is we use simple traditional methods, like lassi or buttermilk, kokum juice, which comes from the Konkan region, from Goa. Kokum juice is a great drink to serve. You can use carrot juice, fermented carrot juice called kanji, but avoid giving that to people with high blood pressure. And if there's nothing else, you can always prepare a lemonade. So you can do a lemonade with water, and you can also do a lemonade with soda or with sparkling water. The taste will be different each time. If you want to serve tea or coffee, especially tea, don't put sugar. Why don't you try to put lots of cardamom or cloves or cinnamon or fennel seed? Each will have a different taste. My favorite is tea with the double cardamom, double elaichi. So try that as well.
So top four fair drinks for festivities then.
The cold ones would be lassi or buttermilk, kokum juice, and lemonade for me. That's in the cold one. And in the hot ones, it might be a tomato soup or a tea with lots and lots of cardamom and cinnamon.
Thank you so much, sir. I think that will solve a lot of people's answers of what to serve the guests for sure. Going on, so sometimes patients find it very hard to resist sweets altogether. So any tips on reducing those cravings and managing those occasional indulgences?
Yeah, that's a very tough task, but if you approach it in a scientific way, it becomes very easy. So there's something known as Ishihara's method of analysis or a fishbone analysis. So the end result is that I ended up eating lots of chocolates or sweets. But what created that situation? Go back. So maybe I was watching TV and suddenly I saw an advertisement of maybe potato chips. That's why I splurged. Or maybe I was fine. I was sitting quietly and minding my own business, and suddenly I got a whiff of aroma, maybe from my neighbor's house. And the food that aroma was so tasty, I became hungry. So you see what led to that. Now, what led to that? I was sitting in my sitting room, but the moment I came out into the balcony, I got that whiff of aroma. Or I was studying and I had no business switching on the TV. The moment I switched on the TV, I saw the ad. Or maybe I was watching XYZ channel. They don't have advertisements there. I moved to ABC channel, which is full of food ads. So you find the reason. That's one. Once you found the reason, what is leading to those cravings, then we need to marshal our own body. So there is something known as hungry hormones. These hungry hormones come from two places. They come from the brain, they come from the gut, and the third is the pancreas. So we should limit the release of these hungry hormones. We should supplement, then we should buffer ourselves with houseful hormones. These houseful hormones, where do they come from? They also come from the brain and from the stomach or the intestine. So how do we increase these houseful hormones? Let's talk about that. And that's what you asked, Dr. Kanksha.
Right.
What is mindful eating? So when you're eating, you eat slowly. Each and every morsel that you eat, think about where it came from. Praise the Almighty, praise the farmer, praise the distribution guy, everyone who has allowed that food to come to us. That takes time, but you get used to it. Look at the colors of your food. Is it light blue? Is it navy blue? Is it in between blue? Whatever you are eating. So look at that, the different colors. Try to see which spices have been used, whether you are eating at home or outside. So you know that some spices may slap you in the face and others will tickle your palate. So see what spices are being used by the cook. That's mindful eating. Another thing is to practice what we call the glossopharyngeal maneuver. So let me invite everyone to practice this with me. Glosso means tongue. Palatal means the top of your oral cavity. And maneuver, whether you spell it in Indian or British or American English, maneuver will be maneuver. It means it's a procedure we are doing. So you take the tip of your tongue. See, I'm sorry, I'm not being rude. And you press it on top of your palate. Now do that very hard. You can't speak and you can't eat as well. Now, this is a physiological maneuver, a glossopalatal maneuver. You can try proximal glossopalatal. So you press your palate near your teeth, a different feeling. Go to mid-palatal, you'll get a tickling feeling, the middle of your palate. And distal glossopalatal, you take your tongue as back as possible. Keep on trying these every now and then. Now, the beauty is, you know where this comes from, Dr. Kanksha? It comes from the Maitri Upanishad, book 6, verse 20. And the Maitri Upanishad says that if you practice this, of course, they didn't use the Latin terms, they used Sanskrit terms. If you practice this, you will be able to attain Brahman. It is a tool for meditation. I personally use it as a tool for self-discipline. If I'm, let's say somebody said something wrong to me, I perceived it to be wrong. Instead of fighting back, arguing back, I just practice the glossopalatal maneuver. If I feel hungry, I practice the glossopalatal maneuver. So I press my palate, I think of houseful hormones, and then the brain begins releasing houseful hormones. So this, Dr. Kanksha, is something that I do. Now, here I would admit lots and lots of people watching us, 5 lakh people watching us. There may be some people who do not like the Maitri Upanishad. Feel free to use the Latin word, glossopalatal maneuver. If you like the Upanishad, you add that to your thinking and you thank the people who wrote that Upanishad for helping us with weight control.
So the mantra for cravings is the Maitri Upanishad or glossopalatal maneuver.
That is what I've been trying. It does help.
Thank you so much, sir. That's something really, really different, which the audience would never have thought of or heard of. So I'm sure they'll practice this. So coming on, for patients managing diabetes over a long period, are there any additional care routines or adjustments they should consider?
Yes, if you've been living with diabetes for a long period of time, especially with uncontrolled diabetes, the chances of complications are higher. So the first thing is obviously you go to your doctor for a regular checkup, but please take the festive season as a cue for a checkup. So go not after Diwali if you've developed a complication, you go before that. Do not go after Ramzan, you go 6 weeks before Ramzan is about to start. And you get a full checkup. That is the first thing I would suggest. The festive seasons are meant for happiness, for health, for harmony. And the best way of ensuring health is a regular checkup. In case there is an issue with blood pressure, with cholesterol, with weight, with the kidney, you get that fixed up. Avoid sudden changes in medication and medication dose during the festive season, especially if you're traveling. So let's say you're going to travel tomorrow to meet your children or your parents, and it's going to be a week long or a 2 week long trip. You are going to be away from your primary doctor. Then today is not a good idea to change your treatment regimen. Either we should have done it a week or 2 weeks ago, or if there's no emergency, you can wait for a week or 2 weeks until you come back. If actually there is an emergency, you will not be able to travel also. So if you're fine, don't make major changes before travel.
That should help all our diabetic patients for sure. So that we all know that some patients with diabetes also have chronic kidney disease. So why is chronic kidney disease a particular concern for diabetic patients, and what impact does it have during festive seasons?
Chronic kidney disease is important. First of all, it is a complication of diabetes. It can occur along with diabetes, so it can be a comorbidity. And it can also cause further complications. So chronic kidney disease itself is a complication, but once you get CKD, chronic kidney disease, it increases the risk of anemia, that's low hemoglobin. It increases the risk of heart failure. It increases the risk of heart attacks. It is also associated with more foot ulcers, more nerve damage. That's why we need to manage it. The good thing is that we can manage it now. We have very good drugs. You need good glucose control, good blood pressure control with a class of drugs known as RAS blockers. You also need to stop smoking, reduce alcohol intake to as much as possible, stop if better. Make sure that you do not suffer from things like urinary tract infection, urine infection, or urine obstruction, which is stones. And we now have modern medicines called MRAs. One example is Finrenone. This reduces the swelling or the inflammation in the kidney. So it helps relax the kidney. These are all drugs that can be used. From a self-care perspective, take care of your hydration, take care of how much water and what kind of water you are drinking. There is a concept known as beverage hydration index. Speak with your doctor about that. Your doctor will talk to you about glycemic index. That means how fast glucose rises after you take a carbohydrate. And if you remember, we said that complex carbohydrates are better. Similarly, they'll talk to you about beverage hydration index, and they'll tell you to take beverages which have a higher hydration index. The best would be water, simple water. And if you get bored of that, lemonade would be the second best choice.
Thank you so much, sir. I think that will help the patients understand the complication and manage it further.
There
So
are,
coming, yes.
there are, Dr. Kansha, though some people with CKD and high potassium. The term your doctor may use can be high potassium or hyperkalemia. In these patients, you must not avoid, you must not take at all coconut water and lemonade. So avoid the citrus fruits like orange juice, lemonade, and coconut water. So ask your doctor about potassium levels. If potassium levels are fine, then you are welcome to take these drinks.
So I think the patients should definitely go and ask their doctors about the potassium levels and what are the high water index, like water containing beverages that they can take. So coming on to our final question, for healthcare providers guiding patients, what key message would you emphasize about managing carb, sugar intake during festivities?
For healthcare professionals, view your patients as human beings, the way you are, the way I am, the way all of us are. Once you understand that the person in front of you is a human being, that human being will have certain limitations, certain failures, maybe weaknesses, but that patient will also have strength and resilience, is it not? So let's view that in a humane manner, in a person-centered manner. What are the things we can do? First of all, talk to your patient about the festive season. So you might say, welcome. So, madam, how do you plan to celebrate this season? Are you going to keep any fast? Maybe a Tuesday fast or a Friday fast? Is it going to be Karwa Chauth or Hoi? Hoi is a fast that we celebrate or observe. The women observe in Haryana for the long life of their sons, their children. So, if you are fasting, madam, what kind of a fast is it going to be? Is it going to be no beverage, no solid, or only no solid? Can you break in the evening? These are questions that you ask. Your patient will smile and she will say, Doc, you're the first person who ever asked me that. Okay, so now what's the next step? Now let's do something called risk stratification. So, madam, based upon your reports, your potassium is high, your creatinine is very bad. Perhaps it might be a good idea to forego the fast. Do you think you are able to do that? Or you are fine, let me give you the following tips and you can fast safely. So usually your patients will be of low risk or moderate risk. So you teach them about what to eat in the morning before they begin the fast. This what to eat, Dr. Kancha, is very important. First of all, remember that the person who is cooking is also a human being, whether they are cooking before Karwa Chauth or before Ramzan. Give recipes which are easy to prepare. Secondly, avoid taking high salt and high spice food just before starting the fast. Take simple things like curd, low salt, low spice, low pepper, and that will take you a long way. Curd and lassi would be the best without salt. Now, if it's a feasting day, then again you say, so you're going to meet loved ones, you would want to eat. So what would you want to eat? And you try to give alternatives for everything. Instead of a gulab jamun, which is fried maida, which is fried refined wheat flour, why don't you take a rasgulla or a rasmalai, which is boiled milk? Yeah, but doc, that has sugar. Yeah, so let's squeeze it out. You get your worst enemy in the family to squeeze out that rasgulla and rasmalai of each and every gram or nanogram of sugar, and then you take it. Practically, you're just eating the milk, which is fine, and you're a part of the family. So you give an alternative for sweets. Supposing it's drinks, everybody else is drinking aerated drinks. What can I take? You take a light version or a 0 calorie version. They are all available. Everybody else is drinking sweet lassi. You take salted lassi or a neutral kind of lassi without salt or sweet. So you have to give alternatives. Everybody else is eating parathas, which have got a lot of oil. So you can take a vegetable. You can grill. You can take a chapati. You can grill a vegetable chapati. So instead of taking, let us say, a gobi ka paratha, you can take a gobi ki roti, where when you knead the dough, you just put the minced cauliflower in that. So these are simple things to talk about to your patient. So you assessed, you evaluated, then you gave options, and then don't remember to forget the follow-up. So in case you get stuck, you can take a tablet of acarbose, or you can increase the dose of insulin. Do not increase the dose of basal insulin. You will have to increase the dose of rapid-acting insulin. So all these have to be told. And the follow-up is, madam, once all this is over, do come back. We'll check your glucose and we'll adjust the dose accordingly. So these are some simple things which will help our patients observe the fasting and festive season in a happy and healthy manner.
Thank you so much, sir. That will help all healthcare professionals. So the last thing would be the top tips on these festivities for everyone. The top tips.
So top tips for festive season for people living with diabetes. First of all, be happy and thank the Almighty that we are able to celebrate this festivity. Second is be rational. Do not fight common sense. Third, you are with your family, so do enjoy. So first of all, beverages. Simple homemade beverages without added sugar. Number two, foods. Try to reduce overall carbohydrates. Try to avoid simple carbohydrates. Increase complex carbohydrates. Before taking the carbohydrate, take a lot of fluid or fiber. First fluid, first fiber. Remember that. After taking the carbohydrate, don't forget to go out for a walk. You can exercise. Practice mindful eating, mindful meditation. The glossopalatal maneuver is something that we all can try. Try to become friends with your houseful hormones instead of with the hungry hormones. That's in the brain and you can do it. And don't forget to reach out to your friendly doctor, your friendly endocrinologist in case you need any help. I wish you all a great festive season. I wish you all the best of life, happiness, and let's hope that we are able to add more happiness to your life with diabetes.
Thank you so much, sir, for these valuable insights. I'm sure this guidance will help many patients and providers navigate this festive season healthily and happily. And to all our listeners, thank you for joining us today. Wishing you a safe, healthy, and joyful festive season. Until next time, take care and stay well.